Angle closure. So in angle closure, there are three categories that need to be known. One is PACS. PACS stands for the primary angle closure contact. This is known as PACS. Next, what we see is PAC. PAC stands for the primary angle closure. Next comes the PACG. The PACG stands for the primary angle closure glaucoma. So looking everything in detail, the PACS, the PACS. So PACS basically it shows the, in case of the gonioscopy shows the posterior meshwork ITC, and this is seen in case of the ITC. Here it stands for the iridotrabecular contact. So here the ITC is seen in three quadrants or more. And there is no peripheral anterior synecdoche. No peripheral anterior synecdoche. Next, if we look at the intraocular pressure, and the optic disc as well as the visual field, all, if you see, it is normal. Next, in case of the PAS, the PAS is, there is no PAS seen. Then looking at the risk of PACG. The risk of PACG, it is at 5 years and maybe around, it is about 30 to 40%. Next, we are looking at the primary angle closure. So the primary angle closure, here the gonioscopy, it shows three or more quadrants of the ITC, intratrabecular contact, and there is raised IOP and the PAS or excessive pigment smudging. There is excessive pigment smudging on the TM, trabecular meshwork, and next there is also a normal optic disc, disc and field as well. Next, we are looking at the primary angle closure glaucoma. That is nothing but the PACG in short. So here the ITC, intratrabecular contact. So here the ITC is present in three or more quadrants, and there is a glaucomatous optic neuropathy. There is an optic nerve damage, and this is from an episode of severe IOP elevation, and this includes such as the acute angle closure, and it may not appear as typical glaucomatous cupping. So there is no typical glaucomatous cupping. Now we are going to look at the symptoms. So in case of the symptoms, this includes pain. There can be redness as well. There is photophobia, as well as impaired vision, as well as there is watering. Pain, redness, photophobia, impaired vision and watering. So now looking at the signs of the angle closure, this includes the corneal edema, nothing but the colored halos. Next, it also includes the conjunctiva, that is the congestion and the chemosis. Then it also includes the IOP. So here the IOP is elevated about say 40 to 70 mmHg. Then there is also AC. This is a very anterior chamber is very shallow. Next comes the pupil. So in case of the pupil, the pupil, if you see, it is vertically oval, as well as it is mild dilated. Next we are looking at the angle. So in case of the angle, it is completely closed, and this is nothing but a grade 0. So how do we treat this angle closure? So the treatment of the angle closure, this includes immediate treatment, and there is something known as a definitive treatment. So in case of the immediate treatment, this includes the IV mannitol, also includes the IV azidazolamide, and this is followed by an oral dose, there's topical beta blockers, as well as brimonidine and the latanoprost. Now we are looking at the definitive. So under definitive, it includes the laser peripheral iridotomy as well as the filtration surgery.